Hi, I'm Hannah and this is Toby. I suffer with dry eczema-prone skin and Toby does as well, so we're off to see Dr. Tomson to see if we can get some advice about how to deal with it.
Can you tell me if Toby has any triggers?
At first it seemed like it was really random, but it seems like any sudden changes in temperature. So I noticed when we got towards the winter and we were putting the central heating on, obviously it was cold outside and then it was warmer in, and I noticed that's when it started to flare up quite a lot. And clothing does seem to have an effect as well.
You've actually identified some of the commonest triggers. If the temperature in the environment drops, then the humidity levels drop as well. And with the natural drop in humidity, you find his skin will become a little bit drier. Other triggers involve pets, and as you've rightly found out, cotton or natural fibres next to the skin are best, as often synthetic fibres or woolly clothing can flare up the skin and make it more itchy. Do you have a routine with applying his creams at the moment?
Loosely. Pretty much every time I change his nappy or his clothing, that's about as much of a routine as I can say that we've got at the moment.
And how much cream are you getting through?
One of the kind of, I don't know, that size bottles. I'll easily get through one of those every kind of week or two.
The advice is for a child, a baby or a child, to get through about 250 to 500 grams of cream per week, which is actually quite a lot. And the best thing is, as you're doing it, just apply it at every opportunity.
Right.
So you're doing the right thing doing it first thing in the morning and last thing at night. And I know as a busy mum, it's difficult to find that time in the day to put the cream on. Perhaps carrying a small tube, a 100-gram tube in your nappy change bag, and every time you can, just pop some more cream on him, especially if his skin's getting very dry. And there is the correct way to apply it, and obviously that would help with not clogging up the pores. The hair follicles can get irritated if the cream's not applied in the right way. Can you show me how you apply the cream?
Sure, yeah.
The best thing to use is a pump, because if you're using a big tub, then you're dipping your fingers in and out, and that can introduce infection into the tub of cream.
So I just kind of literally just smother it on him. I hadn't really thought about anything else, so I kind of just tend to do like circular motions.
It's best not to rub. The ideal way is to pop a little bit of cream on, enough to cover the area, and then to sort of smooth down in the direction of the hair growth. And the same on his legs as well. It's good to use a fast absorbing product in the daytime, something non-fragranced and not heavily perfumed. Fragrance tends to irritate eczema-prone skin and dry skin. Just to summarise, put as much cream as possible on him. You can't use cream too often. Try and avoid his trigger factors. Keep him nice and cool. Wear cotton layers next to the skin and try and avoid wools.
Brilliant. Thank you ever so much. I really
Okay,
appreciate it.
Thank you for coming.
So thank you.
If you or your child suffer from dry eczema-prone skin, here are my top tips.